one of the main reasons for taking measures to flatten the COVID-19 infection curve is to make sure that hospitals weren't inundated with patients. We shouldn't forget, with all of the focus on the coronavirus, there are other conditions that also require hospitalization. These include pneumonia and seasonal flu. The NICD has a plan in place to study the interaction between COVID-19 and influenza. But, strangely, the anticipated flood of seasonal influenza cases hasn't happened. The NICD Centre for Respiratory Diseases and Meningitis co-head, Professor Cheryl Cohen, joins us now with more on this. Professor, good evening to you. Normally we have a flu season. Is it true to say that didn't happen this year?
Absolutely, Stephen, and thanks for having me this evening. This has really been an unprecedented event. In South Africa, we've had, in fact, very strong systems to monitor influenza since 1984, and never before have we ever seen a year where we didn't have a flu season. But this year, we really haven't seen influenza. We have a number of surveillance programs that are already set up to monitor and detect influenza and the flu season. And despite the challenges of COVID, these programs have all remained operational. We've been collecting samples from patients to test for flu, but we just, ever since the national lockdown, we've really only found one positive flu case out of, several thousand samples that have been tested, indicating really, yes, this year the flu didn't come.
Okay, I mean, this might be a slightly strange question, but how do we know, right? Not everyone reports a case of influenza, especially if people have been told to stay away from doctors and hospitals.
So absolutely. I mean, one of the issues with influenza and monitoring it generally is that most people with flu will never get a test. And so in order to get around this, what we do is we have programs where we systematically monitor people with influenza-like illness, which is usually fever and cough. So we have sites in general practitioners' practices, we have casualties or outpatient clinics in the government sector, and we have public hospitals where we have staff who monitor every single person who comes in with that case definition of fever and cough, and then we'll take samples from them and test them systematically for flu to get around this problem of people not being tested. What we have seen is that to an extent, the numbers of people coming forward to healthcare facilities has dropped, it's true, and some of that is probably as a result of COVID anxiety. But we think also some of it is because there genuinely hasn't been nearly as much respiratory viral illness, flu, respiratory syncytial virus, and other viruses bringing people forward. And what we do know is that we've tested more than several thousand specimens, and we haven't found flu at all. And so if there was flu around, we would find it. And importantly, we're testing people admitted to hospital with pneumonia as well. So while some people may be anxious to go to the GP, I think if you're sick enough to have a pneumonia, you'll still go to hospital. And even amongst these people, normally we'd really have seen hundreds of cases of flu, and we just haven't seen it this year.
I mean, there's so many questions to ask. Half of them come from science fiction movies. But my first question would be, is it because we've all been wearing face masks? I mean, for the first time in South African history, everyone I know is wearing a face mask. So no one I know has got flu.
So, Stephen, I think it's really a combination of the effect of all the different measures that we're doing to reduce the transmission of COVID. We know that COVID and influenza have a very similar mode of transmission, which is mostly respiratory droplets. And wearing a mask reduces the extent to which we release respiratory droplets into the air, not so much protecting of you if it's a cloth mask, but certainly if everybody's releasing less droplets, the transmission will go down. Reducing the number of contacts between people will reduce droplet spread. A physical distancing of 1 or 2 meters will reduce it, sanitizing. So all of the measures that we've implemented for COVID are very, very likely impacting and reducing the transmission of influenza. And importantly to highlight, there's another virus, respiratory syncytial virus, that we also monitor in our surveillance. That's the commonest cause of pneumonia in children. And this virus has also dramatically reduced. We also have not seen a season this year for the first time since the virus has been documented. So it's not just flu. In fact, we think that these measures for COVID have reduced the spread of all the other respiratory viruses. And because these viruses are generally a bit less infectious than COVID, they're not new in the population, so we have some immunity. We're seeing this really major impact of these measures, really just cutting the transmission of other respiratory viruses dramatically.
Okay, and now the apocalyptic science fiction movie, which would be, because we didn't have influenza this year, are we all going to be more vulnerable to whatever comes along next year, and we're going to have 5 times the number of cases?
So I think that's really what is difficult to predict. It's really not known to what extent immunity controls the size of the influenza season, and to what extent evolution of the virus controls but we know the main factor is probably that some flu strains are more virulent than other strains. So I think there is some concern that next year we may see a slightly bigger wave of influenza, but to be honest, as I've said, this is an unprecedented event. The world has never seen such a thing, certainly not in the time that flu has been monitored. So we really don't know, what will happen with next year's flu season. And another possibility, and we're monitoring for this, is that we could still, although it's very late now, August, we're almost in spring or summer, as things open up, we're certainly monitoring to see whether we do have a small uptick or increase in our influenza and respiratory syncytial virus, now as society opens up. So all of these are considerations, and we're monitoring it very, very closely to see what happens.
Professor Cheryl Cohen, thanks very much indeed. Co-head of the Centre for Respiratory Disease and Meningitis at the National Institute for Communicable Diseases.